If I take a daily aspirin, can I still get fillers, surgery for under eye bags? I'm 34 years old. I had a stroke 6 years ago and I'm fully recovered. I take aspirin daily. I've developed bags in the past couple years and I'm considering fillers or surgery. Would my stroke or the fact that I'm on an aspirin regimen preclude me from surgery or fillers?
Thank you for your question. You submitted your question with several photos, and you state in your question that you're 34 years old and that you had a stroke 6 years prior and that you are fully recovered, that you've developed these under eye bags, and you're asking, can you still have surgery or fillers given that you take aspirin every day? Well, I can certainly help you with this question by explaining what I do in my practice. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. Helping people with under-eye aesthetics has been a significant part of my practice, and I am very busy with both the surgical solutions as well as the use of injectable fillers in my practice to help people with situations similar to yourself. So to begin with, it's important for there to be an understanding as to the situation that you had where you had a stroke and you've been on aspirin, whether or not your doctor is comfortable with you being off aspirin and for how long. Basically, the concern is about bleeding, and it is not unusual for someone who has to take aspirin daily to still have procedures, whether it's aesthetic or otherwise, by staying off of the aspirin for several days. It is sometimes important for people to do this before dental procedures, as well as medical procedures for routine health maintenance such as colonoscopy. So it would be a discussion with your doctor as to how comfortable the doctor is with you being off aspirin. Given that you had a stroke, it is important also to understand whether or not that holding off of aspirin will put you in any significant relative risk. I would say that in general speaking, because of the effect of aspirin on blood clotting, that in my experience, that a person who is off aspirin for a few days, generally we ask 5 to 7 days, is that they still have an effect on the clotting, because there is also the effect that is also 30 days on the platelets. So that being said, there's still a certain amount of blood thinning that's still present even when you're off aspirin for a few days. Again, every situation is handled on a case-by-case basis, but we have a lot of patients who have had similar stories and are on aspirin for a variety of reasons, whether it's for cardiac stents or whether they've had issues with the carotid artery. There's a lot of indications for being on daily aspirin. So as far as options, whether it is injectables or surgery, this requires first an understanding of what your outcome can be. A lot of times when someone has a mild amount of puffiness under their eyes, injectable fillers can be very effective. Understanding that when you do injectable fillers, you can still be at risk of bruising, that is because you're entering the skin. But what I would say is that there are different ways to do the injectable fillers so that you can actually minimize the bruising. I routinely use something called blunt cannulas when I do fillers under the eyes, and I find that it just works out so well and is so precise, and I do so much of it that it's become fairly routine, and usually bruising is not much of an issue at all. And even with surgery, the techniques employed during surgery and the way we do lower eyelid surgery under local anesthesia with light IV sedation, we actually minimize the risks of bleeding just in the process of the surgery itself, as well as in the recovery from the sedation. A lot of times my colleagues want to put patients under general anesthesia, and people who have been on blood thinners, when you're waking up from general anesthesia, unfortunately there's a risk of coughing that can be significant, which can potentially lead to bleeding. When we do our procedure under local anesthesia with sedation, coughing is not really much of an issue. Of course, people can still cough, but not the way that they would after a tube is removed from their throat after general anesthesia. Of course, anesthesiologists would, of course, counter that. You can put people under what you call a deeper state and take the tube out, etc. But these are things that we've learned to just not need to depend on. The point is that in the right scenario you can do either, but I think it's generally what I counsel my patients is to do whatever is the least invasive first. If we can accomplish an outcome that you'll be comfortable with and happy with, then you can start with something like injectable fillers first. It can be very effective as long as the puffiness is not too prominent. Once it's too prominent, then it's not really that useful to do fillers. You have to do a cosmetic surgical procedure. So I would say meet with qualified, experienced cosmetic surgeons who perform a lot of eyelid rejuvenation, both with injectable fillers and with surgery, and see what kind of impression you get, and take it from there. Again, the answer to the aspirin question is a question that really is between your doctor's level of comfort with having you off of aspirin, but invariably, especially for someone as young as yourself, as you get older, there are going to be necessary times where holding aspirin will be appropriate for medically indicated procedures. So just understand that context, and you'll probably get an answer as to how comfortable your doctor is as far as your relative risk of having another cerebral event. So I hope that was helpful. I wish you the best of luck. Thank you for your question.